Joining us now is Mr. Rick Johnson, President and CEO from the Governor's Foundation for Health and Wellness. Thank you so much for your time today.
Thank you for having me. It's great to be here.
A lot of people know this foundation by, we should probably say maybe a different name or the initiative itself, which is Healthier Tennessee.
Yes.
But for those folks who aren't familiar with this, Mr. Johnson, would you please kind of just tell them what the foundation is all about, please?
Happy to. The foundation was created by the governor last year in 2013. It is a 501c3 not-for-profit corporation funded primarily from the private sector with some money from state government. And its purpose is to make Tennessee a healthier state, to make this a healthier place to live. It's one of the greatest states in the country. Some would say the greatest state in the country. But unfortunately, it's also one of the least healthy states in the country. Has ranked in the bottom 10 compared to other states for the last 20 years. So our mission is to try to enable and encourage Tennesseans to lead healthier lives and to get this great state out of the bottom 10.
Would you say those statistics were a big motivator to create this kind of program?
They were, because we just can't accept the status quo anymore. There's some really sobering statistics that are really bad news, and I have to share a little bad news before we talk about the good news and what we can do about this. As I said, we've ranked in the bottom 10 for 2 decades, never any better than 42nd, as worse as 48th out of 50th. About 1 in 4 adults in Tennessee in self-reported surveys say they smoke. Worse than that, 1 in 5 teenagers in Tennessee smokes. We have about 35% of the population, more than a third, saying we get no physical activity at all in our lives, so we're one of the most sedentary states in the country. And between people who are rated or classified as obese and overweight, almost 70% of us fall in one of those categories. So as a result of all that, we have really high rates of cardiovascular disease and type 2 diabetes and COPD and asthma, and these are all, and hypertension and stroke. And these are all behavior-related chronic diseases, really terrible to have, painful to have, difficult to live with, and they're preventable. Sure. They're based largely on the way we live. So what's that costing us? Why is that so bad? Well, obviously it's costing us a lot of human suffering and a reduction in the quality of life in this great state. But it's also costing us a lot of money, more than $6 billion every year, year on year, that we could be using for education and infrastructure and jobs creation and lots of other really wonderful things that we want to do. So it's a huge burden, it's a huge cost. We can't continue to sustain it, nor should we want to. I mean, we're too good for that.
That's
it's too
right.
good a state for that.
And just as you said, how we behave today and how we treat ourselves and our bodies and what we consume really will make an impact for the rest of our lives in terms of how we live.
It will.
You know, something that Healthier Tennessee encourages, of course, most Tennesseans to do, 3 main things that you all have as far as your platform is concerned, and that is you need to be eating nutritious food, you need to be physically active, and you need to cut the tobacco. Why focus on those 3 things?
Well, those 3 things are the greatest contributors to these chronic diseases that I've been talking about. Being inactive and being overweight and using tobacco directly correlates to having 1 or more of these life-threatening, serious chronic diseases. So we're very focused on changing those. Additionally, when we're more active, when we're eating a healthier diet, and when we're not using tobacco, we feel better. Life's better, and quality of life is better. And so even if we put aside for a minute the impact on chronic disease, the positive impact on just how we go through life is significant as well.
Sure. We talked a little bit before the program began, and you and I were mentioning the fact that, this is your basically goal to have, Tennesseans be healthier. But the nice thing is, different cities across the state are doing the same thing individually. So the message is really being, shouted from the rooftops for everyone to hear. So it's probably nice to be able to have those other different kind of, government entities helping out with something like this.
Yes, and also community organizations and private sector organizations. We have more than 110 organizations and businesses and community groups that our affiliates, our coalition partners in working on this all across the state. It is something that we face in every county in the state, and it is something that we have to work on in concert with lots of other people and on a local basis.
Okay, let's go back to the three things that we had just mentioned, the eating nutritious foods and staying physically active and putting down the cigarettes. What are some small steps, would you say, Mr. Johnson, for folks to, you know, really kind of combat the smoking, but then also to implement the good things of the good foods and getting out there and hitting the pavement in terms of walking or running? Right. How can they start small?
And that really is the key question. All of us know, I think, or at least most of us sure know, it's good for us and we need to be more physically active and get a little more exercise. We need to eat a healthier diet and control our portions, and we sure know we don't need to be smoking tobacco. The question is not what we need to do, it's really how do we do it. And many of us have been frustrated about this and sort of given up before we started because we feel like we don't have time. It's going to be really complicated and difficult. It's probably maybe going to be expensive, and it's going to take a long time. And gosh, you know, I have all these reasons why I really can't do that, and I may not even know how to do it, even though I really have the desire to do it. If I ask you to completely change your life, do something really expensive, really difficult, it's going to take a long time, it's really complicated, you're probably going to say no thank you. I don't think I can do that. But if I ask you to take some small steps, a few small starts to find ways to be more active and to eat better and to not use tobacco, you're much more likely to say yes, assuming they don't take a lot of time. They're basically simple, and guess what? They're free. So we have designed tools and ways that we think people can take small starts, and that's literally what they're called, small starts, to begin to be more active, to eat better food, healthier food, control portions, not use tobacco. We put those on our website, healthiertn.com. You can go there and look at small starts and begin this process of saying, hey, I only have to do a few small things and keep doing them, and then do a few more, and then do a few more, and pretty soon I've changed my day a little bit, and then my whole life has changed. And it's become a habit. It's become the kind of way that I go through the world. So it's a really key message we want to try to get across, that you can start small, you can take small steps, and you can get big positive results from doing that.
Excellent. All right, Mr. Rick Johnson, we so appreciate your time today. And you'll definitely want to go ahead and check out some social media and an application that they've also developed on this great cause.
We have a great free app called Streaks for Small Starts, and that's at healthiertn.com too.
All right, excellent. Thank you so much for your time
Thank
today.
you. It's been a pleasure.